वो भी उनको देना है उनको। तो इस बात को शुरुआत करते हुए मैं रिक्वेस्ट करूँगा डॉक्टर छाबड़ा से कि अपना 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 इमेजिनेशन, अपना विज़न, अपनी गाइडेंस हमको दें कि किस तरह हम लोग जो है। हाँ,
Hello friends. Hello. Good afternoon friends. I welcome all of you on the behalf of Indian Medical Congress. Now without taking much time, let me introduce Dr. R.M. Chhabra. Dr. R.M. Chhabra is a senior consultant physician at Chhabra Medicare Center and Max Hospital, Shalimar Bagh. He has completed the FRCP from the Edinburgh. Also, he has done a certified course in the FDI, diabetes, recognized by the BMJ Royal College of Physicians and presently, sir is founder member of the North Delhi Physician Forum also. So over to Dr. Chhabra, sir. Please take.
Thank you for the kind words, Dr. Avatar. First of all, first of, first of all, I would like to thank you, Indian Medical Congress. A special thank to Dr. Prem Agarwal. He is always kind to invite me everywhere. खड़े हो खड़े हो मजा आता खड़े हो गया खड़े हो मजा आता है खड़े हो मजा आता है So today is the World Malaria Day. So we will talk about the malaria, eradication of malaria, whether it is a myth or the reality. What are the disease pattern in the India? Two types of the disease. One is the communicable disease and the other is the non-communicable disease. What are the non-communicable diseases that is not transmitted by the person to person or by the vector or by the environment. So medical science has identified certain habits and the behaviors that either increase or decrease the risk of the many these diseases like the cardiovascular disease, diabetes or hypertension. In fact, the above mentioned diseases are also known as the lifestyle disease. The disease which occur due to the change in the lifestyle change. So what are the communicable disease? A disease that is spread from the living to the another or through the environment. This is the communicable disease. What are the pathogen for the communicable disease? Virus, bacteria, fungal, protozoal or the rictential. So today we will talk about the protozoals. So how communicable diseases are transmitted? Direct touching, biting, kissing, sexual contact, or the indirect contact, the contaminated objects, vector mosquito passes through pathogen from person to person, or the water, the foodborne disease. Another other airborne disease by the sneezing or the cough. So what is the importance of knowing about the spread of the transmission of the communicable disease? What is the importance of the, no. We can prevent the disease or the control or the treat or the eradication of the disease if you know about the spread of the disease. So management of the communicable disease by the prevention, diagnosis, investigation, treatment control, treatment of the complication and the eradication of disease. Today we will talk about the eradication of the disease, that is the malaria. So today is the World Malaria Day, the 25th April. So today's topic, the eradication of malaria, whether myth or the reality. Worldwide status of the malaria infection, if you see the malaria remains the word, as Dr. Prem was saying, the devastating human parasitic infection, malaria. So malaria affects over the 40% of the world population. If you see the latest incidence in the prevalence of the malaria, according to the latest World Malaria Report, there were 247 million cases of malaria in 2021 compared to 241 in the million in the case of 2020. Increase round about 2 millions in 1 year. And if you talk about the estimated number of the malaria deaths stood at 6 lakh 19,000 in 2021, but it was 625 in 2020. Scenario of the malaria globally and the India. If you see what countries are the most affected by the malaria, Africans are more affected. There are 4 countries: Nigeria, Democratic Republic of the Congo, United Republic of Tanzania, and Nigeria. These are 4 countries of the malaria where the malaria occurs maximum in the number. So, who is most affected by the malaria in India? If we talk about the India, because we are Indians, we will talk about the India. Social and geographical distribution of malaria in India. Malaria affects all the population group, regardless of the gender or the age, although the children and the pregnant women are at the high risk. 2 groups are there. What the events, where the event starts? When the human start from the bite of the, if the mosquito bite the man, that is the intermediate host. The mosquito is the definite host, and the sporogyte which causes the disease. This is the human cycle, pre-erythrocytic goni, and the erythrocytic and gametocyte. These are the cycle of the malaria. I will not go into the detail. This is a busy style. This is the complex life cycle of the malaria, how it is transmitted. So the pre-erythrocytic sporogyte, this is a cycle everybody knows. I will not go into the detail. This is the period which Plasmodium, Vivax, falciparum, malaria, oval, these are the different duration of the infection. The erythrocytic cycle, this is a cycle. Another is the erythrocytic goni, another is the exoerythrocytic phase, and this is the gametocyte phase. Because we should know about this cycle, because we have to treat for the eradication, every level. From the side on, I will tell you in the later on. WHO current or the future direction, drug management of the malaria endemic countries which are experiencing the high level of the resistance of the currently used anti-malarial drug of the monotherapy are advised to switch over to the combination therapy. So treatment of the plasmodium virus malaria and the plasmodium ovale, that is the, everybody knows the chloroquine or the primaquine. These are drugs everybody knows. I will not go into the detail. This is the pharmacotherapy of the anti-malaria drug. Everybody knows. I will not go into the detail because I am focusing on the eradication program. So this is the pharmacotherapy of the anti-malaria drugs continuation, and this is the algorithm of the treatment of the malaria. If you talk about the prevention, prevention is very, very important for the eradication. If you prevent the disease, you don't require the doctors. You don't treat the disease if you prevent the disease. So in the prevention, you have to avoid the mosquito bite. How we bite? By wearing the long sleeves of the shirts and the trousers, insecticide treated bed nets. We use the nets in the later on. Nowadays we are not using, we are using the good night and all that, repellents, all the things. And repellent creams or the spray we always use. These are prevention. Prevention of the disease is very, very important. Chemotherapy, chemoprophylaxis, everybody knows. We use the either chloroquine or the mefloquine. We use for the chemoprophylaxis. Vaccine is important. Nowadays, vaccine is not available. But the children are usually most vulnerable to the malaria because they have not built up the natural immunity like some adults. In the Africa, one child dies of the malaria every 30 seconds. And there are some ways of the prevent of the malaria, killing the infected mosquito or the bed nets, and some medications to treat the parasite, and effective vaccination is the key step towards the eradication of the disease. Till date, I think a vaccine is not available. So more studies are going on, they are in the pipeline. We have to find out the vaccination to prevent the malaria, otherwise malaria cannot be prevented. Vaccine is very, very important. So now I will come to the eradication of the malaria. Why we are failing? Because we are not having the holistic approach. We are talking about this gathering only, media, or the persons are not involved, that's why the malaria is not being eradicated. You see, the smallpox eradicated from the India. I think the last case of the smallpox in the 1975, if I am not wrong. 1975, the last case. That was a complete eradication. We are also eradicating the polio also. We are trying. So eradication, who are the accountable to eradicate the malaria? Public is the first to prevent the disease. If public is not cooperative, you cannot eradicate the malaria at all. Another government, non-government organization or the medical association. all are very, very important to eradicate the malaria. If one chain is fail, everything will fail. Another is the positive attitude of the media. Media is very important. मीडिया को ये बता देगा मलेरिया से वो मर गए, ये मर गए, वो नहीं बताएगा इसका इलाज क्या करें. पॉजिटिव एटीट्यूड कभी मीडिया का नहीं होता. अगर पॉजिटिव एटीट्यूड हो तो बहुत चीज़ें हमारे सफल हो जाएं. तो मीडिया का इम्पोर्टेंट बहुत रोल है. कैसे उसको अवेयर करना है, पब्लिक को कैसे करना है, मास स्केल पे करेंगे तब हम इरेडिकेट कर पाएंगे, अदरवाइज नहीं कर पाएंगे एट ऑल. द हेल्थ वर्कर्स, ऑल द हेल्थ वर्कर्स फ्रॉम द सफाई कर्मचारी, अगर पानी पड़ा है, कहीं पड़ा है, वो काम नहीं करेगा, इरेडिकेशन कर नहीं सकते. एवरी पर्सन इज इम्पोर्टेंट टू इरेडिकेट द मलेरिया, वेयर वी आर फेलिंग टू इरेडिकेट द मलेरिया. Another is the for malaria eradication, we have to update the knowledge, everybody, from the public to the government even the officials, we have to tell them what is the malaria. If they don't know about the malaria, but they manage with the zero knowledge of the malaria. You have seen the COVID management, all the official, जितने भी नेता हैं वो भी कह रहे कोविड को ऐसे करते हैं, जीरो नॉलेज, बट दे आर मैनेजिंग द कोविड. द मेडिकल फैसिलिटी इज अवे. That's why we are failing in eradicating every disease. We have to involve the medical fraternity to eradicate the disease, because the medical fraternity is the backbone of every management of the every disease. So, if you see, we have to enhance the coordination among all, from the top to bottom. We have to coordinate each and every person. We have to take the classes of training classes, nursing classes, doctors की classes, सफाई कर्मचारी, everything we have to take the update. ये नहीं कि सिर्फ डॉक्टर कॉन्फ्रेंस में करेंगे अपडेट. We have to update each and every word, either by the media or every pamphlet or the flyer, whatsoever. We have to educate the person. But now what is the scenario? Everybody say like this. क्या आप डॉक्टर साहब बताने की जरूरत नहीं है, हम सब ज्ञानी हैं. Am I right? This scenario. But dear friends, आपने 3 Idiots में कहा होगा, नॉलेज जहाँ से मिलता हो आप बटोर लीजिए. तो हमें जहाँ से नॉलेज मिल रहा हो, ये नहीं कि डॉक्टर बताएगा तो जहाँ से भी आपको नॉलेज मिल रहा हो, तो आई ऑलवेज लर्न फ्रॉम यू एंड ऑल दैट. मैं आई विल कीप माई सेल्फ एज ए स्टूडेंट. वेयर आर आई गो, आई कीप माई सेल्फ एज ए स्टूडेंट. दैट्स वाई आई लर्न सो मेनी थिंग्स फ्रॉम ऑल ऑफ यू. सो डियर फ्रेंड्स, वी हैव टू चेंज आवर एटीट्यूड. सो what are the requisites of the eradication of malaria? क्या क्या requisition है? Public must be aware about the malaria infection, especially of the transmission. If you aware the public about the transmission, most of the 70% work is done. Transmission के बारे में पता, मच्छर को control कर लिया, malaria होने के सवाल नहीं हो. तो this is the very, very important point. Another is the coordination among the government, non-government organization, medical association, public, doctors and the healthcare workers. Unless until coordination is done, you cannot do anything. Another, resources and infrastructure must be available. ये नहीं कि गवर्नमेंट के कागजों में तो काम चल रहा है, वहाँ ये भी अवेलेबल हो गया, ये भी अवेलेबल हो गया. Practically there is nothing. You cannot eradicate. You have to provide the full infrastructure to eradicate the malaria. Properly implementation of the eradication program. ये नहीं कि आपने हेलमेट लगाना, कोई हेलमेट लगा नहीं रहा, आपने रूल पास कर दिए, प्रैक्टिकली नील. वी हैव टू इम्प्लीमेंट. उनको बताना है कि हमारे ये प्रोग्राम हुए, जाके आशा वर्कर को, दूसरे वर्कर को, सबको बताना है कि ये प्रोग्राम हमारा हुआ है, इसको प्रैक्टिकली इम्प्लीमेंटेशन कीजिए. नहीं करोगे, इरिडिकेशन कभी नहीं कर पाओगे, भूल जाइए आप. अनदर इज द पॉजिटिव एटीट्यूड. द मीडिया इज वेरी वेरी इंपॉर्टेंट. उनका पॉजिटिव एटीट्यूड नहीं होगा तो इरिडिकेट नहीं कर पाएंगे. टाइम टू टाइम सर्वे ऑफ द इरेडिकेशन प्रोग्राम. ये नहीं कि आपने आज प्रोग्राम बना दिया, 3 महीने भूल गए भी क्या प्रोग्राम बनाया. टाइम बाउंड प्रोग्राम मस्ट बी देयर. जैसे एक आपने टाइम बाउंड कर दिया, आपने 3 महीने में ये काम खत्म करके प्रेम जी को बताना है, तब जाके मजा आएगा. यहाँ इंडियन कांग्रेस के जितने भी प्रोग्रेस है उनको बताना है, क्योंकि ये इंचार्ज हैं यहाँ के. जब तक ये टाइम बाउंड काम नहीं करेंगे तो यू कैन नॉट पास इन योर वर्क. आपका प्रोजेक्ट कभी पास नहीं होगा. अनदर, what is the principle of the malaria eradication program? Principle, malaria prevention control have 3 principal components. One is the reduction of the contact between the vector and the human spot. That is the prevention. You have to break the contact between two. Another, prevention of the disease through the prophylactic use, either anti-malaria drug, chemoprophylaxis, or the net or the any use. Another is the adequate treatment of the malaria episode to minimize the risk of the transmission. अगर किसी में हो गया है तो मच्छर आगे जाके ट्रांसमिट नहीं करे, उसको ब्रेक करना हमने चेन को. Another, what is the objective? Our objective of this program, the main objectives are: one, early detection and the prompt treatment through the surveillance activities involving the government and the NGOs, functionality or the identification of the high-risk malaria areas and epidemic-prone villages. We have to survey all that area. And other interpretation of the malaria transmission by 2 rounds of the residential insecticidal spray of the DT 50% in the area with the annual parasitic index and above. The distribution of the insecticide treated bat nets in a high risk accessible village. We have to, rather than कि हमें खाना फ्री दे दो, ये फ्री दे दो, की बजाय हमें प्रिवेंट करना है तो हमें ये चीज़ें फ्री देनी पड़ेंगी. वेरी वेरी इंपॉर्टेंट. द खाना इतना इंपॉर्टेंट नहीं जितना मलेरिया इंपॉर्टेंट हो जाएगा. तो वी हैव टू गिव द फ्री. अपने एनजीओ से लीजिए, स्पॉन्सर लीजिए, उसको हमें बीइंग ए डॉक्टर वी हैव टू प्रोवाइड देम. अनदर इज द IT information, education and the communication activities, public-private partnership, involvement of the NGOs, FBO or CGOs and the other government and non-governmental, military and the paramilitary forces in malaria control program. You have to involve each and every person to eradicate the malaria. And what is the National Malaria Program, eradication program? If you see to combat the devastating effect of the malaria, the National Malaria Control Program was launched in 1953, built up around 3 key activities like the insecticidal residual spray and with the DTT and the monitoring and the surveillance of the cases and treatment of the patient. 3 key points out there in the 1953. But in 1958, what was the National Malaria Eradication Program started in 1988 with the failure. They failed, and in the 1970, so many cases came back in the 1970. This is the failure of this program. So that is converted to the NAMH, but laterally they have given the name, the non-communicable disease, communicable disease with the vector-borne disease of the community parasite. How many countries are malaria-free by the WHO? Round about globally, 40 countries and the territories have been granted the malaria-free certification from the WHO. Recently include the El Salvador, Algeria, Argentina, and Paraguay, and Uzbekistan. These are the countries which have been recently certified for the malaria-free. If you take the eradication program, is the need of the arts. Make it reality with the broad vision and the combined efforts. आपका broad vision होना चाहिए और combined efforts होना चाहिए from bottom to the top, top to the bottom. If you treat the malaria with tubular vision, like a picture, if you see this picture with the tubular vision, it is a very beautiful picture. If you see with the broad vision, it is not beautiful. So treat the malaria with a holistic approach and the broad vision, and beware of the tubular vision. Don't take the tubular vision. So in the last take-home message, dear friends, decide yourself about the eradication of the malaria. Is it myth or the reality? Decide yourself. It is up to you or us whether we want let the eradication of the malaria program be the myth or make it the reality. It is up to you. हम मिथ रखना चाहते हैं या रियलिटी बदलना चाहते हैं. So nothing is impossible in this world. Everything is possible. I am possible. Nothing is impossible in this world. If you do the combined effort, definitely you will eradicate the malaria. And these are the media picture. You see the same picture. They have given the different view. In this, there is no accident. There is no accident. But with the change of the view, they have shown the accident. So we are the scientific person. We have to give the reality, not the myth. So thank you very much for the listening program. Thank you very much.
डॉक्टर छाबड़ा का एक ही कमाल है कि सबसे मुश्किल टॉपिक को किस तरह आसान कर दें। अब यही बात प्रॉब्लम है कि जो है पूरे हिंदुस्तान के हेल्थ प्लानर्स समझ नहीं पा रहे हैं कि मलेरिया इरेडिकेशन कैसे करें। और पूरा हिंदुस्तान में 50 साल पहले सपना तो खैर हमेशा से ही है कि मलेरिया से जान बचाएं। मलेरिया, माला एयर, गंदी हवा, इसने मतलब इतने आदमी मार दिए कि कभी भी सोच नहीं सकते कि कितने आदमी मार दिए विश्व में। तो एक सपना हमेशा सबके पास है, इससे जान छुड़ाएं। और हर सोसाइटी, हर देश इस सपने की तरफ काम कर रहा है।